Come in.
Hi, Hannah. How are you?
I'm good. How are you?
Good. I'm Corey. I'm going to be your midwife today. We met at your first visit, and then my partner saw you. So now I'm going to be seeing you today. What brings you in?
Well, I work at a grocery store and I've been working a lot, up early and staying late at work. And I just keep having these dizzy spells where I almost pass out.
Oh, I bet that was scary.
It was scary. And I know I'm in my second trimester and I just want to do everything right. And I just don't want to do anything that can hurt my baby.
Right. Well, as I was reviewing your chart before you came in today, I see that you're 24 weeks. When did the dizziness start? Has this been going on for a while?
Well, it happens mainly at work. I like to sleep in, so I'm always rushing to get to work on time, and I guess I just don't eat breakfast, and I'm running around all day at work, and I guess I just don't take time for myself to eat or rest or anything like that.
What were you doing exactly when you started to feel the dizziness?
Just, unloading trucks or just being a cash register person. I mean, just being on my feet mainly.
Okay. How often would you say this happens through your shift? Or does it happen when you're not at work too?
I mainly notice it when I'm at work. It normally happens about once a shift. So that's why, it's been happening for the past 2 weeks. So that's why I was like, I need to come see my doctor.
Okay. Does anything make the dizziness better or worse?
When I do feel like that and I sit down and, try to eat something, it does help some.
Good, good. So eating, you've noticed that eating makes it better. Was there anything like in the room or the environment? Was it really hot in there? Or was it not well ventilated?
Well, ever since I've, become pregnant, I do get hot a lot. So maybe I could ask my boss if I could, have a short sleeve shirt with, the company's name on it instead of a long sleeve shirt.
That's a really good idea. Or a fan maybe by your register that if you needed that, if it's a hot room. And you said eating made it better. So that's a good idea too. Are there any other problems that happen with this? Do you feel nauseous or do you throw up or a headache, blurred vision, or any black spots in your field of vision?
Sometimes I do get nauseous and I do see black spots, but I don't have a headache or I've never actually thrown up or anything like that.
Okay, okay. And how about I was looking at your chart and I saw your medical history, but I just want to make sure nothing's changed. Do you have any heart problems or any history of anxiety or any problems like that?
Well, since I have become pregnant, I am very anxious. I'm, try to work as many hours as I can because I need to make as much money as I can so I can provide for my baby. So
Sure.
that's caused a lot of anxiety. So
Okay. Well, all the things that you're telling me are really normal things in pregnancy. So try not to worry too much about this. But I have some ideas if you'd like to discuss them on how to help these symptoms. That is a very normal part of pregnancy. So if you have time, I'd love to go over those with you.
absolutely.
Okay. Well, I bet that was really scary. And I'm so glad that you remembered that we told you to make an appointment when something abnormal happens. But just so you know, there's just no worries for you or your baby. And that we have ways that we can kind of work on this. So your body's going through a lot of changes right now. And some of those symptoms that you're experiencing are hard to exactly pinpoint what's going on. But since it's a combination of things, we're going to do a few of these little tips and tricks that we find that help. So throughout the day, when you're getting out of bed in the mornings, especially, or even getting up from a sitting or standing, sitting position to standing, try to get up kind of slow and take your time. When you get up from bed, when you're laying down, like you set up, make sure you dangle your feet for a little bit and give your body some time to acclimate a little bit because your blood pressure goes through some changes. You have extra blood volume when you're pregnant. So let your blood pressure, give yourself a little chance so you don't get so lightheaded when you get up. And then When you're sitting, you can get up slow as well. And when you're laying on your back, don't lay flat on your back when you're laying in bed, because pregnant girls should never lay flat on their back. They should always tilt a little bit to the left or to the right side, whichever way is more comfortable for you. Left is best, but right is all right as well. And then try and eat small meals through the day. I know it's hard in the mornings to get that meal in, but there's lots of like great, there's cereal bars that have protein in them as well nowadays. And then there's juices available that are portable too. So if it's something that you can do to take this portable with you would be great too, because I understand liking to sleep. I like to sleep too. And especially when you're growing a baby, you're extra tired. So anything you can do to make your routine easier for you in the morning would be fantastic, because eating those small meals through the day with protein in them would be helpful too. And have some snacks available with you to have throughout the day too. Because if you're eating small meals throughout the day, that's going to keep your glucose and your blood sugar pretty even throughout the day, because sometimes that can be a symptom too that is making you kind of dizzy. But if you have chest pain or shortness of breath, or you have actually fallen or faint, I would like for you to be seen in the office right away. I don't want you to wait. I want you to call and make an appointment. And if we're not open, if it's after office hours, I'm going to give you the number for the hospital as well, in the OB department, so you can call them and come in and be seen. Does that sound like this is all reasonable stuff that you can do?
It does.
Okay.
I appreciate everything, all the information that you're giving me, and I'm really going to try to make time to eat something in the mornings and try to do everything that I can for my baby.
Absolutely. And hey, I'm going to call you in a week to see how this is going, and I'll be in contact with you, okay?
Okay, thank you so much.
You're welcome. It was nice seeing you again, Hannah.
Nice seeing you.
Bye-bye.